that Chicago has become America's largest outdoor shooting range. Do you think it's because of Chicago citizens who have no criminal record, but who have lawfully a gun in their home for protection or perhaps for hunting? Or do you think it's because of a finite group of criminals who have rap sheets as long as King Kong's arm?
So Mississippi, Louisiana, and Missouri actually have higher firearm death rates. Obviously, there's certain...
What about Chicago?
So I don't live in Chicago. It's not my primary area of research.
You don't have an opinion on that?
I think there's easy access to firearms combined with environmental conditions, lack of great education. There have actually been studies showing that when you green vacant lots and repair abandoned buildings in urban neighborhoods, you see decreases in gunshots, in violence, as well as in stress and depression in the neighborhoods around them.
No disrespect, Doc, but that sounds a lot like word salad to me.
Don't you hate pausing your workout to adjust your phone? Problem solved. The all-new Gym Monster 2 keeps things neat and effective.
I am a board-certified emergency physician and dean of the Yale School of Public Health. I've spent nearly 20 years working as an emergency physician in a top-tier trauma center. Here in the U.S., treating firearm injuries is a routine part of emergency medicine. During our training, we learn how to identify who must go right to an operating room, how to crack the chest of someone who's bleeding out, and how to notify family members of a death. While in training, though, we rarely, if ever, learn to ask what could be done to prevent a gunshot wound in the first place.
I understand getting rid of guns and taking action in Chicago and all these I guess you want to say hoods, like gang places. What about the mass shootings? What about, you know what I'm saying? What about the mass shootings that's been happening in the U.S. almost 3 to 4 times a week? What about cleaning that up too? Because that's a mass shooting. That's shooting multiple people. I don't know. I feel like both shooting in general is wrong. There's a shooting somewhere every single day, and I hate it so much, man. It's for no reason too. Wow.
That changed for me about 15 years ago, after I cared for a young man, the son of a first responder, who had shot himself with his parents' firearm. He was the first patient I'd cared for who had intentionally shot himself. I couldn't save him, but he changed my perspective on gun violence. First, his death drove me to learn more about firearm suicide, to realize that in the emergency department, we rarely saw suicide attempts from a gun, not because they were rare, but because they were so often fatal. Second, his death led me to question why we didn't think about gunshot wounds the same way we think about drunk driving or heart disease, as something we can and should prevent. Most disturbingly, I noticed the difference in how my colleagues responded to this suicide compared to the everyday toll of community gun violence. Since that case, I have treated people for every type of firearm injury, from domestic violence to victims of drive-bys. I've saved some lives, but not all, and have informed countless families of the loss of their loved ones. And it is because I have had a front row seat to our nation's growing firearm injury epidemic that I have worked to define and implement a public health approach to this crisis. To clarify, this is how a public health approach works. First, we gather data on the problem. How common is it and who is affected? Second, we define risk and protective factors. What increases or decreases the chance of someone being hurt or dying? Third, we figure out programs that work to change those patterns, to avert injury, hospitalization, or death. And finally, we scale what works. America's total number of gun deaths is the highest on record, and our rate nears its peak. Firearm deaths have surpassed breast cancer deaths in America. Firearms are now the leading cause of death for American children age 1 through 19. Although mass shootings get the most media attention, 2/3 of firearm deaths are preventable suicides, averaged over the last decade, like that young man I cared for 15 years ago. I have story after story of public health collaborations between gun owners and non-gun owners, hospital workers and community violence interrupters, faith leaders and survivors. We have shown we can reduce the risk of a shooting long before someone picks up a gun with intent to harm. Through your bipartisan commitment to this public health approach, our country can reduce firearm injury and death for all.
Let me ask you this. In September of this year, our New Mexico governor issued a public health emergency order, and she suspended the right to bear arms in Albuquerque and the surrounding county. Do you support that?
I do not. What I do support is the work that New Mexico has done
do you support that?
No.
You don't? Okay. Let's see.
What do y'all think about that? Do y'all think the gun laws should be more strict? You think we should just ban guns altogether? Or you think it's too late? There's too many guns on the street for us to ban guns in states or in the whole entire country, because everybody else got guns on the streets. Like, you would have to go and wipe guns from everywhere. Do you think they should go door to door and car to car to wipe these guns off the streets? Or do you think everybody should be armed and dangerous? Even though I know the US is not gonna, the US want guns on the streets. They want mass shootings, bro. I promise you they do. They would have been did something. But they were about getting rid of healthcare. I mean, making healthcare more expensive and getting rid of like food stamps and stuff like that. But they're not worried about the gun shit going on. It's insane to me, man. I don't get it. It's gonna be a long 3.5 years that we got. It's gonna be a long 3.5 years with this president, man. I don't know.
During his first 2 years as the DA in Philadelphia, District Attorney Krasner Loster dropped 47% of all the illegal firearms cases in the city. Do you agree with that?
I'm not a lawyer. I'm a physician and a public health professional. I can say that New Mexico has done amazing work in trying to address the suicide and partner violence.
I'm asking about Philadelphia.
I don't have an opinion.
The DA dropped 47% of all the illegal firearms cases. Did he do the right thing there?
I don't have an opinion. However, I will say that just as with fentanyl, the spread of illicit substances.
I'm sorry to cut you off, but I'm running out of time.
Understood.
The LA District Attorney, George Gascon, said that he would not prosecute any sentencing enhancements for guns or gang-related activity. Do you think he did the right thing?
Again, I am neither a lawyer nor a prosecutor.
You don't have an opinion on that?
I honestly don't know enough about it to have an opinion.
You don't think gangs should be prosecuted for having illegal guns?
I'm neither a lawyer nor a prosecutor, and that's not my area of research.
But yet you want to take guns away.
I've never said that I want to take guns away.
From law-abiding citizens.
I think that you are saying something that I've not said in my written or oral testimony, sir.
Okay. You equated gun deaths to heart disease in your opening statement.
Yes, sir.
Which is a greater public health problem, gun deaths or heart disease?
So heart disease does kill more folks across the United States, largely in the end of their life.
About 700,000? Mm-hmm. Yeah. Gun deaths about 50,000?
Correct.
Do you support outlawing fried foods?
I'm sorry. How does that relate to?
Because fried foods contribute to heart disease, don't they?
Again, I have not written or said that I support outlawing.
You're a physician, right?
I am. Have I said that I support outlawing anything in my testimony today?
Okay. Let me ask one more question. I'm sorry, I cannot see that far, Doctor, on the very end.
Cozy Gay, thank you.
Yes, sir. You said, I wrote it down, you said that no one should be judged by the worst thing they have done in their lives.
Correct.
If one of these young doctors sitting behind you, God forbid, walks out on the streets of Washington, D.C., and is raped or sodomized, you don't think the rapist should be judged?
I don't think it should be terminal. It shouldn't be for the rest of their lives.
You think we should forgive them and not give them any punishment?
I believe in
You think
forgiveness.
nobody's responsible for their actions?
I believe in responsibility. I believe in forgiveness.
Thank you, Mr. Wow. Thank you.
I'm kind of mixed up on what this guy said that's on the screen. I think it depends on what the crime is, I guess. Because, like, a rapist, oof. I don't know if you can forgive somebody like that, give them a second chance. It's so tough. Yeah, let me know down in the comment section. Like, somebody like that, should they get a second chance? That's so tough, man. That's so tough. I feel a lot of people should have second chances. Some people shouldn't. Like, murder, I guess depends on what the murder is, even though nobody should kill each other. But if it's self-defense, and you know what I'm saying? You come into my home trying to steal and kill my family, it is what it is. But the rapist part, though, man, I don't know if you deserve a second chance, but you should definitely. I think everybody should get mental help. Like, everybody should go through. I don't fully agree with the prison system and how they run it, but I think people should get help before anything, bro. Like, I can't really speak on murder, people that murder people or rapists, but I think everybody should get mental help, at least mental health programs. Not necessarily freedom, but it shouldn't be. I don't think it should be the way jail is. Just jailed up all day, no sunlight. Get a 1 hour on the yard. You eat the worst food in the world. Like, I think that's inhumane. That's what they said. Even though being a murderer, being a rapist is just horrible. But I think people deserve second chances. But I think they should go through programs, and that should be tested for some to see if they should be given a second chance. But I don't think prison is the way to go. Let me stop yapping, y'all. Make sure y'all like, comment, subscribe. It's getting crazy in this world, and we're just here for the ride along, man. Hopefully we make a difference. Love y'all. Peace and love, baby. We out.